We all know you got vaccinated yesterday, so you've actually had the vaccine. I think most people want to know today, how are you feeling? Are there any side effects?
You know, I really feel really fine. For at least 5 or 6 hours after the injection, I didn't feel anything at all. I mean, less so than a flu vaccine. Then a late afternoon, early evening, I started to get a little bit of an ache, really nothing to distract me or bother me, but just something that when I press on it, you could actually feel it. Had a good night's sleep last night. I didn't get, a lot of muscle aches or anything. I mean, I felt something a little different, like there was something going on, like maybe a little warm, a little flushed. Woke up this morning, I feel perfectly fine. The only thing I have now is that where the injection site is still is a little sore. But when I say sore, I mean really not very distractingly sore, just baseline, borderline.
If there are side effects, how quickly would they kick in?
They usually all occur within the first 12 hours and they last between 24 and at the most 36 hours. It's extremely unusual for someone to have something beyond 36 to 48 hours.
Now, you said in getting your inoculation, it was for two reasons. First of all, you are a physician, you were actually treating patients. But secondly, you wanted it to really represent to people that this truly is safe. We don't need to be worried about it. Do you have a sense that there is much resistance at this point in the vaccination program?
You know, it's getting better, thank goodness. When we did surveys, a month or so ago, there was almost 50% of the people had some reservations or skepticism about getting vaccinated. The last survey, which was just last week, they said that more than 65% of the people said that they would be willing to get the vaccine. We really want to get that up even much higher than that, because the projection is that if you get anywhere between 70 and 85% of the population vaccinated, you would create an umbrella of immunity over the community, which could really get the level of virus so low that it would not be a threat. And then you could answer the question that everyone seems to be asking appropriately, is that when can we start approaching some degree of normality? When can we be doing things like safely having the children in school, or going to a restaurant and sitting indoors, or going to a movie theater? I would think if we start getting the general population vaccinated, let's say mid-April, between now and then, we're going through the various priorities. We started off healthcare providers and people in nursing homes and long-term facilities. The second level is people over 75 and individuals in what's called necessary or important places in society to keep society running. And that could be anything from a police officer to a fireman to someone who runs a grocery store so people can get food. When you get through those priorities and you get to what I call open season, like anybody can get the vaccination, even though you're not in a priority group, I imagine that's probably going to be sometime in April. And then if we can really get vaccines going in April, May, June, July, and August, by the time we get to the end of the summer, I think we can get to that goal that I'm talking about getting the overwhelming majority of the population vaccinated.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.